Good day to everybody, everywhere. Welcome once again. Thank you for joining us for the Shang Institute School of Tibetan Medicine webinar series. Here we discuss topics of health and wellness, exploring tools from Eastern and Western traditions, from ancient spiritual philosophies and healing sciences to modern research and current issues in global public health. It's great to be back for our webinar again after a couple of weeks. Today, we're going to be discussing caring for our elders during the COVID-19 crisis. We have our special guest, Dr. Gerry Steinberg, and our ongoing host, Menpa Phuntsog Wangmo. My name is Adam Okerblom. I'll be your moderator. This week on the Shang Institute School of Tibetan Medicine webinar series, we speak with Dr. Gerry Steinberg about caring for geriatric patients during the COVID-19 crisis. Our ongoing webinar host, Menpa Phuntsog Wangmo, shares principles of elderly care from the tradition of Tibetan medicine. Dr. Steinberg and Menpa Wangmo will share a wealth of knowledge and experience from a Western and Eastern medical perspectives, as well as tools for understanding and managing our health during this difficult time of the global pandemic. So I'd like to tell you a little bit about our school, our institute, and Tibetan medicine in general. At the Shang Institute, we work with traditional Tibetan medicine. So for those of you who aren't so familiar, what is Tibetan medicine? Well, traditional Tibetan medicine, this is one of our world's ancient systems of medical science, going back many centuries. Tibetan medicine has its own set of classical texts, along with many generations of commentaries and academic study and debate, as well as centuries of clinical application. Tibetan medicine has shared influence with the other major streams of medical science from the East, such as Ayurveda, Chinese medicine, and also Greek and Persian traditions. Tibetan medicine is based on the theory of 5 elements, the kind of 5 natural primordial elements of the world as relate to our human condition and our human health. It features specialized diagnostic methods such as analysis of the pulse, of the tongue, of the urine, and other methods. Tibetan medicine uses a wide array of therapeutic methods of treatment, which are covered in 4 main categories of methods of treatment of disease and prevention, which will be diet, lifestyle, herbal medicines, and therapeutic treatments. So if you're interested in learning more about traditional Tibetan medicine, please like and subscribe the Shang Institute School of Tibetan Medicine. We would love to connect with you. Our school was founded by the late Chogyal Namkhai Norbu, a great scholar and spiritual master, Tibetologist, and Dzogchen teachings. We have programs internationally. We offer a variety of courses and programs on traditional Tibetan medicine around the world in various countries, as well as online. Our courses range from short educational lectures to continuing education courses for healthcare professionals, and as well as our full-length flagship program, our 4-year diploma program, full professional training in traditional Tibetan medicine. And in fact, our 4-year program is going to be starting its new cohort in January of 2021. So if you are interested in dedicating to serious long-term professional study of Tibetan medicine, then please check our website and you can learn about the upcoming new module of the 4-year program. So our website is tibetanmedicineschool.org. So please join our email list. We'd love to keep in touch with you with updates and events and new programs. And of course, follow us on social media as well. Really quickly, one more housekeeping thing before I introduce our guests. I would like to mention the American Tibetan Medical Association, ATMA. You can go to americantibetanmedicalassociation.org and learn about ATMA, which is the United States professional organization for traditional Tibetan medicine. We offer resources for practitioners, database of practitioners across the country, and also for patients and supporters headquarters. So if you want to learn more about Tibetan medicine and you want to get involved in the United States National Tibetan Medicine community, then please consider joining the American Tibetan Medical Association. We're accepting professional memberships as well as student memberships and supporting memberships as well. So join this org. You can find resources, how to find a qualified Tibetan medicine practitioner in your local area, learn about educational courses, and much more. Okay, so without further ado, I'd like to introduce today our special guest is going to be Dr. Gerry Steinberg. Dr. Steinberg has been a practicing physician for over 45 years. He started out as a primary care physician in a small town in Western Massachusetts, which is near and dear to us. We love Western Mass. He developed an interest in rehabilitation medicine, working as an assistant medical director of a small community hospital rehabilitation unit. Over the last 25 years, Dr. Steinberg has been practicing rehabilitation care for elders in skilled nursing facilities. Gerry Steinberg has been a student of Chogyal Namkhai Norbu, our institute founder, since meeting him in 1982. Dr. Steinberg, thank you so much for joining us. How are you doing today?
I'm doing great, thanks.
Excellent.
Yeah, 45 years seems like it's a long time anyway.
Absolutely. So then we have our ongoing webinar host and our Institute School Director, Menpa Phuntsog Wangmo. Menpa Wangmo is a practitioner of traditional Tibetan medicine with over 30 years of experience in clinical practice as well as teaching. Menpa Wangmo received her advanced degree from the Lhasa University School of Traditional Tibetan Medicine. She is the director of the Shang Institute School of Tibetan Medicine. Menpa Wangmo teaches Tibetan medicine programs all around the world. She has developed our school programs and implemented them, and she is our teacher of programs in the United States, in other countries, Spain, Italy, Russia, and various places. Menpa Wangmo is also the co-founder of the American Tibetan Medical Association, ATMA, the Tibetan Medicine Professional Organization. Menpa Wangmo, it's wonderful to see you again. Thank you for joining us. How are you today?
Thank you. I'm doing well. Thank you.
Excellent, wonderful. And again, my name is Adam Okerblom, a doctor of acupuncture and oriental medicine and alumnus of the Shang Institute School of Tibetan Medicine. I practice Tibetan medicine and acupuncture here in the San Francisco Bay Area. So thank you all of our guests for joining us, and thank you for our support staff, our technical support, Matthew, and our translators. So today we're going to discuss caring for our elders during the COVID-19 crisis. As we know, there has been an alarming rise in cases across the country, and there is a huge problem of many geriatric cases. We have a lot of cases in nursing homes and a lot of complicated cases with our elderly population, and it's definitely a very big deal. So Dr. Steinberg, can you tell us a little bit about this kind of situation, because you are on the ground working clinically with a variety of elderly patients, and I think that you've seen some COVID patients as well. So first of all, can you just introduce yourself a bit? Tell us a little bit about your medical practice and your career before we go into the more specifics of the current COVID situation.
Sure, like for the last 25 years, I've been practicing mainly in skilled nursing facilities, and in those kind of facilities, we take care of basically two different specific cohorts of patients. We are the primary care providers for the people who live in those facilities and manage all of their general medical problems and cognitive issues as well. Then the other aspect of our practice is it's called subacute rehab. And what that involves is taking care of patients who have been in the hospital for a variety of reasons, anywhere from an orthopedic problem like a fractured hip or an accident to very complex medical issues, wound care, diabetes, heart, cardiac bypass surgery, whatever. And those patients are sometimes not able to go home directly from the facilities that are in, the hospital that they're in, because they don't either have the care or they still have ongoing medical issues. So what we do is we take them into our subacute units and we manage their medical issues, as well as they're seen by their rehabilitation staff, which involve like therapists, occupational therapists, physical therapists, speech therapists, who try and work on getting those patients back to their home environment, and social workers as well. So we have a team approach to caring for these patients, and our role is basically to manage their medical care. Most of the patients are in the geriatric age group, although it's not exclusively geriatrics, because there are patients with chronic disease who are in their even 40s, 50s, and 60s with very severe kinds of chronic diseases or chronic neurological diseases, or other problems that are, kind of they've had for a long period of time, that also require them to have continued medical care before they go home, or they are still weakened from their acute hospitalization and need to go back to a facility like ours for rehabilitation as well. There's also, within the kind of hospital environments in kind of Western medicine, acute rehabilitation hospitals. But in order to go to an acute rehabilitation hospital after you've been in a hospital, you have to be able to undergo a lot more therapy, like 3 hours of active therapy a week. And many of the kinds of patients we care for don't have the capacity to undergo that kind of level of therapy. So they come to our kind of facilities, which are less intensive. Both these facilities can also take care of very complex medical issues, which we do. Patients with complex diabetes, heart failure, wounds, chronic lung disease, liver disease from chronic alcohol abuse, or from various kinds of hepatitis, and the whole myriad of disease processes that can affect human beings, actually. And we can care for those patients before they go home. And we also do IV antibiotics, IV treatments, fluids, and IVs. We do a lot of things that used to be done just in the hospital. Now we can do in the skilled nursing facilities.
Right, thank you. A lot of people, I think, don't realize how complicated geriatric care can be. We have these elderly populations. Obviously, we know that elderly people are going to, have more propensity for ongoing health issues and acute and chronic conditions, but it's just so complicated. The Western physicians I know in my life who do a lot of geriatric care, you have these populations who have been through many things. They've been through the era when everyone spent decades smoking a pack a day. They've been through a lot of alcohol. They've been through the 1980s and 90s era of terrible food, a lot of times. And and then you have these populations have a lot of medications to manage and ongoing chronic conditions. So it's not a simple matter caring for these elderly people. I really commend you for that work.
Yeah, that's true. I mean, there's a lot of kind of variable reasons why people get these chronic illnesses. Some of it is genetics, some of it is personal choice, or we don't, and as you said, we really didn't understand a lot about the contributing factors to these chronic diseases over the years. So there's a combination of things, and also just sometimes people have bad luck. So it's a combination of all these factors that kind of create it. We've had a lot of experience in these facilities with COVID, and it's been pretty devastating to this population as well. And we can go into detail if you like when we discuss it further.
Yes, absolutely. Will you tell us, to get into that now, will you tell us a little bit about how the COVID-19 crisis has affected logistically your practice in terms of, are you in terms of seeing people face to face, or the precautions and PPE equipment for the staff at the facility? What are the kind of the logistic? I know many clinics have shut down entirely. So what are the logistical adaptations that you guys have had to make to deal with COVID enhanced precautions?
Well, it's been pretty complicated. And at the beginning, we were very kind of ill prepared, I think, from a public health standpoint, and also in terms of a general understanding of what this disease process is. I'd like to just give you a brief overview of what happened in one of my facilities, which will give you a sense of how this happened. we discovered we had one case. So this was back when the disease was in its peak in Massachusetts. We had discovered we had one case. That patient was put in isolation. We weren't exactly sure where that patient got it from, but we were suspecting it was from a speech therapist who had been to other facilities that had had higher incidences of COVID. So that patient was put in isolation. We used very full PPE, which means gowns, either goggles or a visor, eye protection, N95 or KN95, masks, gloves, everything. And in spite of all that, within the next 2 or 3 weeks, we had 55 cases in this one facility of COVID positive patients. Many of them ended up going to the hospital, and we had 13 deaths. This is in one of my facilities. It's kind of very strange to understand, because some patients who had the same comorbidities or very similar comorbidities to other people were totally asymptomatic, and others got very, very sick and died, and others kind of got somewhat sick and survived, and basically got back to their baseline status. So that was at the beginning, and since then, I think the Department of Public Health has learned a lot, and so have we. We've had, for a while, I had another bunch of facilities, like 3 of my other facilities, where there were no cases at all, and we were very happy about that. And then all of a sudden, about 2 weeks ago, there was a case where a nurse's aide who worked in one of our facilities became COVID positive, and then there was another one. And before we knew it, there were 14 cases in that building. Instead of it spreading even more, the DPH now has a rapid response team, which comes in. We isolate the whole group of patients that were positive in a separate unit, which we were doing before otherwise when we got these larger cohorts of patients. And we were able to contain the spread from those 14 patients, so there were no other positive patients. And because, I don't know why, but in that particular cohort of patients, we haven't had any that have gotten really life-threatening, or we have had some that have had pneumonia in that group. But most of those patients now are doing well. The requirements now have been very stringent from the from DPH in Massachusetts and from the hospitals. Before patients come to us now, they're tested at least twice. And when they come into the facilities, they are still, even though they're tested negative, because we won't take them unless they test negative, we still have to do full PPE on those patients for 14 days, which means the goggles or the visors, the masks, the gowns, and the gloves. And we're being extremely extra precautious. So there's like 3 different levels of kind of protective equipment that we use in the facilities. Obviously, we use masks on all the patients who are there. And we also kind of encourage the patients to wear masks, but sometimes it's difficult for them because of their age and their frailty, and they feel kind of constricted by the masks. But so we have just people who are kind of in the nursing home who haven't had it and haven't been exposed to it, and we just have to wear masks for them. Then we have people who have actually have active COVID, and they're on a special unit, which is very isolated, and the precautions there are extremely stringent. Then we have the patients who have come from the hospital who are COVID negative, but we're still concerned, and we're still cautious with those. So there's kind of 3 different levels of kind of protection that we do among those patients. Anyway, so that's kind of the way it's set up right now in the skilled nursing facilities.
Right, yes. So in the first facility that you mentioned, where tragically you had numerous deaths, which I'm very sad to hear. So you said you had 55 cases, and then what is the resident population there? How many people was that out of?
70, maybe, I think, like at that point it was like in the mid-80s. That was a very high percentage.
Okay, so 55 out of 80 or so people.
Yeah, it was pretty amazing. And what happens too is sometimes some of these patients have been on what we call palliative care to begin with. And so when they got COVID, the families decided not to be aggressive at all with the care and to just keep them comfortable. So we worked on just keeping those patients comfortable. And so these patients were in palliative care, so they were probably, their life expectancy was relatively short anyway. And this probably just hastened their deaths, but we weren't aggressive in treating those. So that was a subgroup of the population that passed away. But there are some others that were relatively healthy. They had comorbidities. And those folks, some of them went to the hospital and did okay, and some didn't. And the major issues that we saw with these patients were the pulmonary and GI symptoms. Patients developed very poor appetites, didn't have any interest in eating. And then families had to decide what they wanted to do, whether they wanted to feed these patients artificially or just do the best they could and see what happened.
Right. So the the factors that mainly contribute to death with COVID and that you've seen was mostly the pulmonary and also the GI. So basically everyone's has this pneumonia pattern with the GI pattern complicating.
Not everybody had pneumonia, actually. A few people have pneumonia, some people have the GI, and also when they have the GI, you end up getting people get dehydrated and they get into kidney failure. And then they also can get other various effects if they get septic from the COVID and get this, quote, cytokine storm, and then they get total organ failure. But usually, before they got to that point, we had transferred them to the hospital to be under the aggressive treatment in ICUs or whatever, unless they were in palliative care.
Right. So you explained that even across the patient population, many people had similar comorbidities, similar health challenges and chronic conditions. But then the factors that would lead to some people passing away and other people recovering, it was kind of it's hard to really pinpoint exactly what that's all about. It's a little bit hit or miss. Is that how I understand?
Yeah, I mean, it's a big question mark because they all had the same comorbidities. Not exactly the same, obviously, everyone is a little bit different. And some did. We actually had a 103-year-old lady who got COVID and was relatively asymptomatic. She had no symptoms from it. Once we got a case or a cohort of cases, then we would test everybody. And so there were a certain subset of patients that were also asymptomatic that never had symptoms at all, even in this frail elderly group. And currently, we're still testing very, very vigorously in the nursing homes. I'm getting tested weekly, even though I try and stay away from it because of my age. My nurse practitioners who are younger do the direct care until the patients are 10 to 14 days post, and I will supervise them, but I would not see the patients directly. I did some telemedicine and I'd supervise my nurse practitioners. But we're all getting tested weekly on any facility where anybody has tested positive, even someone who works in the office and has no patient contact. If you have anybody now that's test positive in a facility, like a long-term care facility, this is in Massachusetts, then basically every week for a certain period of time until there's no positive test for a certain period of time, every week everybody gets tested. And then they kind of ramp that down. And so there's a very vigorous testing protocol now to maintain or try and keep the COVID at bay in the skilled nursing facilities. And generally, since the big surge that we had in March, other than this one facility I just mentioned, most of the facilities have been relatively quiet and really been kept under control by the vigorous kind of protective equipment and by the testing.
So the cases in Massachusetts in your area spiked way back in March. Was that the peak time?
Well, the peaks, the major peaks that were basically all the first peaks that they had in New York and Massachusetts and in New England, we were in part of that. I don't remember the exact dates, but it was, with the first peak of the virus. And now Massachusetts is way down. I mean, we still have there's still anywhere between 15 and 30 deaths a day in Massachusetts, anywhere from 100 to 300 cases a day in Massachusetts. But it's much, much lower than it was.
Right. Okay. Pretty stable. Would you say that about that 10% ratio of fatality is about right?
Well, it's hard to say, very hard to say. I think this is a very specific population that we're talking about here, and with the high comorbidities, frail elders. And so that, I think the mortality there was fairly high, but I think it varied from place to place and timing and what was available for treatment and whether families elected to be aggressive or not to be aggressive with their loved ones.
Yeah.
So it's really hard to say, but the mortality in the community is much, much lower. I mean, there's various,
sure.
less than 1%, generally speaking.
Yeah, absolutely. Wow. So you guys had a really big spike. So can you tell us, Dr. Gerry, can you tell us a little bit about how they are treating these populations when people do develop symptoms? Then what are some of the stages of treatment in general?
Well, it's basically supportive treatment. In our facilities, we have not been experimenting. I know there was some facilities that were experimenting initially with the hydroxychloroquine, which has now been considered that it's not helpful. Although you do hear kind of anecdotal evidence, some people still think it's useful, but generally speaking, it's not considered to be a treatment. So basically, we did not treat patients in our facility with remdesivir or any of the other potential treatments like convalescent serum and things like that. Those were kind of reserved for the very, very sick patients. Most of the patients that we sent to the hospital were basically...
What is convalescent serum? What is that?
Convalescent serum is they take the serum from patients who've already had the disease and have developed antibodies, and they pool the antibodies and treat people with the antibodies that have been developed by people who already had it. And there's been some success with that, as well as with some of the antiviral medications. But in our facilities, we didn't do that. Basically, we did supportive care only. And in the facilities that we send these patients to, some of them might have been treated with some of the antivirals, but mostly it's supportive care, especially in the ICU. If they need to be on a ventilator, they put on a ventilator. And we treat the patients with basically intravenous fluids. Sometimes they develop secondary infections. So if they developed a secondary pneumonia, and sometimes it was very difficult to distinguish whether the pneumonia was a COVID-related pneumonia or a bacterial pneumonia superimposed on COVID, or a combination of both. So sometimes empirically, we would just treat patients with antibiotics as well, because we couldn't be sure whether they had a superimposed pneumonia. There are some tests that you can do that give you an idea of whether they have a bacterial pneumonia, but those tests can take a little while, especially in our environment, to come back. So we couldn't really rely on those tests, so we had to kind of just play it by ear, so to speak. And if the patient had a severe pneumonia and their white blood cell count was elevated, then we would also treat them with antibiotics. So it was IV fluids, antibiotics if needed, respiratory support. The other problem was, because of the way COVID is spread, we use a lot of the aerosol treatments in nursing homes, where we give patients breathing treatments by aerosol, which are these breathing machines where they inhale. But the aerosol treatments were contraindicated in the facilities during the COVID crisis, and they still are, because of the risk of spreading the virus via aerosol. And so we were limited to just kind of the inhalers that we could use, and these little machines that encourage people to breathe, and central spirometry, in terms of helping them with the breathing, and respiratory therapy, maybe working with the patients to help them breathe, and learn breathing techniques. But basically, it's pretty limited in terms of what you could do. It's basically supportive care and wait for them to get better.
Right. Yeah, it's really scary stuff, especially when you consider that people can develop a viral-based pneumonia, which will be completely unresponsive to antibiotics, and so it's then the antiviral therapeutics are pretty limited benefits. So it's really scary for a lot of these cases.
Yeah, definitely.
So, and then when people, have you experienced this at all? We've been hearing about cases where people are in kind of the active COVID cases. People are in the kind of advanced, heightened, sequestered kind of isolation. So people can have this kind of isolation for a protracted period of time. And then sometimes they're on the respirator and they're having like really strong therapeutics. And of course, they're very sick. And so a lot of these people, we've been hearing about cases of a type of post-hospitalization psychosis, where people have kind of a really acute, strong PTSD pattern. People can have some kind of like a psychosis symptoms or extreme depression or mania as a result of this just very traumatizing situation of being quarantined in a hospital for a prolonged period of time with this terrible illness. Have you seen anything like that?
No, we didn't see that, but that's not new to COVID. There's been like this post-ICU syndrome around for a while for people who have been in those environments for a long period of time where they have those similar symptoms. We didn't really see some of that. I mean, we've seen patients who deteriorated from their baseline and who never really recovered, but that more medically as well as cognitively. So we have seen people who had cognitive issues to begin with. You know, we do take care of patients with progressive dementia, and sometimes when they have an acute illness of any kind, it can affect their cognitive decline, and that can worsen over a shorter period of time. So we have seen that.
Right. Sure. Definitely. And then can you tell us a little bit, Dr. Steinberg, about some of the other post-COVID syndromes? I know that people can have a lot of lingering effects, a lot of complications, and so there's some specific patterns, as I understand, that are quite common for the kind of post-COVID sequelae of ongoing symptoms. Can you tell us a little bit about that?
Yeah, I think this is interesting from the point of view of Tibetan medicine as well, because there's no treatment approach for these patients from a medical standpoint. And I would think that Tibetan medicine might offer some potential for helping this kind of situation. A lot of these patients are very similar in terms of their kind of syndrome symptoms that they have to other chronic disease, kind of post-acute problems like people who have chronic Lyme disease, other chronic fatigue syndrome in general. And there's a new name for this disease now called muscular encephalomyelitis, but it's basically the same thing as we used to call chronic fatigue syndrome. And chronic fatigue syndrome basically can have various aspects to it, but it's something that has been seen now. I don't see it so much in my environment, but I'm aware of it, and I've been reading a little bit about it. Where patients get this brain fog where they're cognitively not as clear as they used to be, they have difficulty concentrating, their memory is impaired a little bit. They can have physical fatigue where they have very, very poor response to recovery from exercise. They can have generalized difficulty kind of with their general energetics in terms of on a day-to-day basis where they have no energy to do things, they have difficulty concentrating. They can have progressive breathing difficulties, which never really get completely better after they've had this. And so those are kind of the predominant symptoms that these people develop, aches and pains, kind of myalgias and things like that. And it's a pretty scary situation because no one really knows how long this is going to last, whether it's going to get better, whether it's going to continue. And basically the only treatments available from a medical standpoint are the things that we use in general for preventive health, which would be just trying different kinds of nutritional supplements, you know, stress management, light exercise, not heavy exercise at all, getting enough sleep, eating a really good diet, but there's no real specific treatment for these.
Right. Yeah. Well, I would absolutely agree with you that Tibetan medicine would be able to have some very effective tools for that sort of thing. One aspect of treatment that we use very commonly in Tibetan medicine is our myofascial therapeutics, our body work, which we call kunye massage. And if you look at the classical text of Tibetan medicine, the Gyuji, the root text, it specifies that kunye, this kind of warm, restorative bodywork therapeutics, is really useful for people who are recovering from chronic disease and have that fatigue, emaciation, this kind of ongoing, lingering depletion from chronic disease. So Well, I think that that could be something that Menpa Wangmo can tell us a little bit more about. But Dr. Steinberg, thanks so much for filling us in on all of that. Anything else for now regarding the situation in your clinic and your practice that you wanted to mention before we move on?
Not particularly in my practice, but in general, what I've been reading a little bit about in terms of prevention, I think we don't know really if any of these things objectively, like we don't have any kind of statistical or scientific information about it, but certainly within the kind of integrative medicine, functional medicine community, people talk a great deal about just the basics that we should be doing to take care of ourselves to kind of boost our immune system, which is again, diet, exercise, sleep, and stress management. And one thing that interests me in this particular area is something we have some experience with in our community, in our Dzogchen community, as well as through the Institute, is complete breathing. And I think learning how, how to basically have total use of your lung capacity through various exercises to develop the awareness of where your breath is and how your lungs are being used could be of great benefit to people if in fact they do develop this problem. Because one of the treatments that they were doing for patients who were having respiratory difficulties before they would put them on a ventilator was what's called prone breathing, where they'd have people lie on their stomachs to breathe. And there's an aspect of, I know, in complete breathing where you do kind of learn how to breathe into your back as well. So I think that's something that would be very useful. The other things that people are looking at is bioflavonoids, vitamin D, and zinc as potential things to help boost people's immune systems to aid in potentially protecting them in some way.
Yeah, I would definitely agree with that. Pointed out in these systems of Tibetan yogic breathing based on the yantra yoga or the Trulkor yoga systems, as we say, then you have various techniques for expanding the breath and kind of training to utilize a full expansion of our lung capacity. And as far as I understand, that's really important for recovering from this kind of illness. Well, we'll come back and chat a little bit more about these things. I'd like to go now to Menpa Phuntsog Wangmo, our ongoing host of the webinar series. Menpa Wangmo is the director of the Shang Institute School of Tibetan Medicine, and she has worked with all of our student base around the world in this kind of capacity. So Menpa Wangmo, good morning. How are you today?
Good morning. I'm doing good, thank you. It's so interesting to listen doctors talk.
Yes, absolutely. So tell us a little bit about how has the COVID-19 crisis affected your community with the Tibetan community, and in particular with your practice. You know, in Tibetan medicine, we work very hands-on with our patients, touching their pulse, looking at their tongue. So how has this crisis with the physical distancing and the quarantine, how has everything affected you working with your patients and also with the Tibetan community in your local area?
The spiritual communities, the Dzogchen community, especially this local, my community, I think we did pretty good. So at the moment, so far I didn't hear anyone sick. So this is one really is good, because we have half of our community members are senior age, like myself. So we are pretty okay so far. So this is one thing. And then the second, the Tibetan community in the local area. Also, thank God we did not have maybe one or two persons, something happened, but yeah, it's cured, and then nothing happened, serious things. But the Tibetan community, peoples who live in New York, New Jersey, is like more bigger cities like Minnesota, those area, yes, it is affected. So this is one thing, but during the time, I think the physically we are sort of like a distance, but I think that our heart is more like a closer as a sort of like sense of the communities. So I think this also helped a lot. Like the Tibetan community, if someone is sick, they try to cook, they try to shopping, they try to deliver. So they did this kind of lot of like a support. So all those kind of like the mentally aspect is helped. They feel sort of like a more closer. It's like supported. And then the other part is like in general the Tibetan, so normally our diet, our behavior is slightly different than the uh, other, I think, other sort of like communities, because it's like drinking hot water is sort of like for us is naturally comes with. Uh, we it's not something like to drink cold water a lot. So this hot water, drink simply hot water, this also sort of like it comes to the health is a big sort of like like a input, you know, like a benefit to the health. So these kind of things also then is sort of like a certain food, like we like to eat more sort of like warm, kind of like the cooked, steamed. So this kind of food, we don't eat a lot of like the raw food. This also, I think, in general health talking, they helps a lot, especially when we get in the little aging time. Uh, and then another one is also our general behave, sort of like either we are sort of like a good practitioner or not good practitioner. Like myself, I'm not good practitioner at all. But still we chanting mantras, and then still we have sort of like idea of the, you know, the life, how would be the life. We always not expecting like a life need to be is a stable this way or that way. We always expecting that the so life is the same as like a spring's weathers. So we says like so like the spring weather, the spring is day is long. The our weather is like cold, raining, hot, so like changing moment by moment. It doesn't stay. Even one day weather doesn't stay. Same like that way, if we have a little longer life, our life will not be as stable, either this way or that way. Health problems, mental problems, economic problems, this problem, that problem. Even if everything goes well, but we are automatically aging, and then our joint is cracking, knee is bothering, digestive is not working, and the memory is losing. So even as we are doing everything perfect, but is something we can see is changing. So this sort of like the the Tibetan Buddhism help sort of like the Buddhism or pre-Buddhism knowledge, sort of like we these kind of things we naturally comes within our culture. So I think this kind of like basic drinking hot water, nothing fancy things, but the drinking hot water special that the morning drinking hot waters, and the understanding sort of like life is not stable, so can happen at any moment, something can happen. So this kind of like already prepared. So I think this kind of thing also helped.
Thank you so much. So, okay, that's very beautiful imagery. That so you have the springtime sort of metaphor for life, and yeah, you can have a lot of rapid changes in weather, unstable, unsure about what problems you may have, windy, rainy, cold, maybe sunny. But then this is also springtime, so then with these unstable potential problems, you have the capacity to have a beautiful spring and a rebirth and a growing and blossoming and succeeding. No?
Yeah.
That's really beautiful. Thank you. Right. So you mentioned drinking hot water in the morning and some of these kind of basic cultural health practices that are not quite so ingrained in Western society. And, you know, everybody's talking about boosting our immune system and our immune function to fight COVID. Everyone is taking their zinc and vitamin D and trying to figure out how they can boost their immunity. But in traditional Tibetan medicine, we know that our immunity is going to be very intrinsically based on protecting our digestive fire and boosting our metabolic strength. So something like drinking the hot water, using some warm spices, this is a fundamentally helpful. So I think, so, okay, so Genla, today we're discussing caring for our elderly population and special considerations for older people. And I know in Tibetan medicine, we have a lot of specific plan and consideration for our elderly population. So what would you like to share with us today about these kinds of things?
Okay, thank you. Yeah. So when we're talking like seniors or elderly or seniors, so the number one, I think the senior people, included myself, we need to understand is like we are one of the fortunate beings because we have enough long life to be in this legacy of the seniors. To reach to the senior is not something everybody can do. So many people, I mean, the infants can be something happened during the pregnancy time, someone's during the birth time, sometimes is like the childhood and then youth and the middle age, so on and so forth. So to really get into the senior, it need to work hard, and then to get there is like full maturity of their life. So the number one, I think you need to understand that and then to appreciate that and then to proud of that. And then the individual persons get into that age and then their families need to understand that, because it is sometimes when we're thinking like a senior orderly, it looks like it's not a perfect one, you know, but it's not that one, because it's more than perfect. Because to reach there is really is like, you know, because we're cultivating the fruit or the grains, we want to get the fruit to get in the hand. Same like that we get senior age means is your like a whole life legacy sort of like matured, so completed. So this is one thing. But then, as I said before, even everything's good, but impermanent as it comes like momentary by the momentary, our body structure is changing, whole system is changing, which means is all the essence of the five element sort of like the declining, same as like our machines, you know, new machines, and then using then consumed certain their power. So this kind of time, there is, we can be done is two main things. The first thing is the important sort of like the food, the terms of the diet to preventing from the aging. And then second one is through the behave. So the terms of when we're talking like the food, yes, in generally eat more like nutrition food, less like heaviness food, like less gluten food, but is like well nutrition food. So this is important because easy to digest, because is all the five element is losing, a sense of the five element losing. Signs of that, when the essence of the fire element losing, then our memory is became more dull, vision is became a little more blurry, and the digestive is doesn't function same as like before. So then we have less like the appetite, and then even we eat, it takes a long time to digest, so on and so forth, included constipation, so those kind of appears. The losing signs of the essence, the wind element, Then again is our like the memories effect, and then we don't get like a good energy of the memories, so like sharp, so this kind of memory losing. And also body became like heavy, mind, body, everything became heavy, also losing like memories, and then all the movement, all the circulations, and the essence of the earth element losing. So then that causing us sort of like a body sort of like a gain weight, heavy, but it is all the muscles sort of like a no tight, everything sort of like losing. And also at the time, and then more like shiverings, not able to walk properly, voice is shaking, body is shaking, and also mind is not stable. So the body, mind, speech, all aspect is became like unstable. And then the space, sort of like essence of the space element is losing. And because of that, then we became sort of like our mind is less open. Then we became more sensitive, very easily cry, very easily get angry, very easily sort of like sensitive. So then our mind became is more sensitive. That means is that the each essence of each element is reducing. Is nothing wrong. It is like the normal way because it's impermanent. But in this case, what we can do is sort of like try to building up or try to maintain the element as before, as much as the before. So this is in the Tibetan medicine we call is like the Julin, like a geriatric cares. So when we talk in the Julin, the number one is to drink the hot water. Again, is go back to the hot water, because is like the drink hot water is not something scientifically need to prove. I don't think so. Maybe they can prove for sure, but it's very logical. We eat day, night, 3 times, minimum 3 times a day. And then our digestive heat is it became slower and then slower, weaker and weaker. And then there remains a lot of like mucus, undigested mucus. So that also causing us like congestions, bloating abdominals. So then there are also many other signs comes. So, and they need to clean those things to melting clean. To melting clean, if you drink more cold, doesn't working. An example, if we have like dirty dishes in the sink, if you want to clean, no, do not need it scientific proof, but clean with hot water, and it works. If they need it, put a little bit of soaps, and then even do better. Same as like that way, and then put that the hot water also to clean. So daily base sort of like to clean, the hot water is good. When we're talking the hot water means is boiled, the water need to be boiled. But when you drink, of course, not hot. Whatever the temperature is good for you. That does not mean is okay, drink very hot and they burn out all your tubes. No, you drink whatever that is suitable for you, but important water is boiled. So this is a number one. The number two, then is like that the food when we're taking the food, we can choose two different foods. One is to building up the immune systems, which in the Tibetan medicine we call the dang, to building up the dang. And then another one type of food or spices to protecting the certain organs or the general body types. So this kind of reason is like the two different food is good. But the first one is to building up the bodily constituents is need to work with the individual cases, whatever the person's individual conditions, regions, locations, so on and so forth. So then we put all those kind of together, then we make that the more appropriate diet. So that we don't talk today so much. And then the second one, to protecting things, which is more like the Ju. Ju means is essence, Lien is like abstracting the essence. if we lost like the earth element, essence of the earth element, this function, my body is shaking, my body is not able to walk in stably. And then what we need to take is essence from the outer materials, earth element, and then to restrain our inner earth element. So for this kind of reason is like that all the sweet products, like meat groups, dairy groups, grains, all those kind of like that we're counting like the sweet groups. So it's very important. It's like an example, like a bone broth, meat broth. So those kind of like for the senior people, it's very good to restrain the bodies. So you can make like a good bone broth, and then you can put like vegetables, then you can use that way. So this kind of like the meat product is good, dairy product is good, and also like rice, barley, so those kind of grain also very good. Because is a barley and the wheat is similar, but is totally different. Barley is warmer and then wheat is cooler. Barley is less gluten and then wheat is more gluten. So those kind of things. Another one also is good to using sort of like if you have more sort of like losing the fire element, which means is a digestive system dysfunction to time. Now you try to drink the ginger tea or the cardamom teas. So ginger and the cardamom both is like warm, light, natural spices. It's very good to building up the metabolic systems. When we're talking like immune systems or the Tibetan medicine, we call them dang. Where the dang or the immune is coming from? They're coming from the essence of the food. The Tibetan medicine dang is coming from the essence from the food. How to get the essence from the food? First thing, we have to have a good, strong heat in the body. Like if we're cooking a food on the stove, how that food will come is depend with that fire on the stove, that fire. So the fire is that the digestive heat. So to restraining that is ginger is good and the cardamom is good. But for the senior people, probably the cardamom is the better. So this is one thing. Once we to restrain the digestive heat, no matter what you eat, and then they will abstracting well the essence. So this is sort of like sometimes we say cardamom is very good to restrain them down, which means is to clean or to restrain the metabolic systems. So these kind of things, one is good. The second part, as when we're working with like the special like now, this the COVID-19. So COVID-19, as that before that the doctor said, they also affect many other organs, and one of them looks like the main one is like the lung, attacking to the lung. Because the lung is the one of the respiratory sort of like that all the energy where is like original, like all the oxygens. And the lung is sort of like the main organ, sort of like pumping that one. So, and then once the lung is something happened, then is entire body is not getting the oxygens, which means is then eventually all the system will stop. Why is mainly in the lungs, according to Tibetan medicine, why this type of like disease mainly attacking to the lung? Because the system of this disease is come within like the breathings in the air element. According to Tibetan medicine, this disease, how they come to the body through the air element. Air element is who is the main responsibility of the air element, or the first which machine, which organ contact with the air element is the lung. So that way they affect first in the lung. And then special that the lower parts of the lung. So then they are accumulating sort of like a liquid, they're not able to like dividing or purifying the raw oxygen what we breathe, not able to divide well, pure, impure. And then everything turns into the impure, then accumulate the liquids in the lung. So this is sort of like that the Tibetan medicine understanding of this that we call as immune disease. So like the COVID-19, I mean, it's very similar with the COVID-19, probably is the same, but the treatment is responding as like same way. So these kind of cases, what we can do to prevent, what we can do is like in generally drink a little bit of cow's milk is very useful. Pai women lo de jong la pen, so any kind of like lungs problem, cow's milk is like nectar for that. Of course, need to find is like good qualities of the cow's milk, that's for sure. But what you need to do, have a glass of cow's milk, have glass of like water, boiled together to reduce 25% the quantity reduce, and then you adding a little bit of honey or molasses, whatever you like the sweet, and then you can drink. If you don't like sweet, also that's fine. So this kind of milk does not have fatty to problem to causing like the cholesterol, also still have the nutritions. And that makes sort of like smoothing all the pipes, the breathing system. So this is also is very useful. Another one also like the cloves, one of our spices, common spices, which is the cloves. Cloves is very good in medicine. We use the Tibetan medicine clove. We use like the against it to the bacteria to prevent it from the catching cold. And also we use as to curing the after catching cold. And special is also very good to this all the breathing pipes, the breathing systems. And special this one that the clove is one of the Tibetan medicine, one of the best for the thyroid and all those sort of like the systems, this area. So for that reason, also we can make the tea out of the cloves. So you can boil like the 3 to 7 pieces of the cloves, boil into a 1 cup of water, try to reduce it down to the like a minimum 25%, try to reduce down, and then cool down, and then you drink as the lukewarm. And also you can add in sweet, without sweet also fine. At least every morning you try to put 1 piece of clove like in the mouth, like raw clove, put it in the mouth, and then chew a little bit. It's very good for the like the antibacterial to the gums, teeth, and also other respiratory systems. So this also would be one is very useful, good. Another one is very important. Another one also like the grapes, grapefruit, the grapes. So the grapes, we have many different way. We say grapes is good for this way, that way. But main grapes is one of the main medicine for the lungs. So grapes is very good for the lung. And also grapes is very good to restrain the bodily constituents. But that the eating a lot of grapes fruit every day, inside the grape a lot of like sweet liquid. Sometimes people who has diabetes may not the best options, or people who has like weak digestive systems. So what you can do is using the raisins. So you can sort of like 1 handful of the raisin, clean well, put into like teacups, like in like a teapot, put it inside the teapot, adding like hot water, boiled hot water, and then leave minimum 15 minutes. Then you can start the drink, put it in the cups and the drink, and then you can adding again the waters. And the grapes became like the size of like a raisin became like size of grapes. That means is all the essence is gone. So then you can throw away or you can eat whatever you wanted. But grapefruit, the raisin tea is very good for lungs, also good for livers, also good for the true softening all the vessels, also internal to make soft. So the grapes is like it's a very useful one. Also, there's many other times we use the grapes for the bones issues. We use grapes for the brain issues. We use grapes for the skin issues. We use the grapes for the like the fighting for the like the catching colds, like the flu things. Also, we use the grapes for the heart disease, and also we use for the blood pressures, and also we use for the blood thinner. So we use grapes many different way, but in this time for the senior, I think will be very important to try to drink the more like grape teas. So this is another one important. Then the last one important one is the nutmeg. So as before the doctor mentioned, in generally when we getting in the senior age, and then our like among the 5 elements, the wind element is became more predominance. Signs of that, then we have a lot of like the unstableness things. And in the meantime, also this kind of period of time, also we have a lot of like anxieties and the depressed and this and that. So many people calling me also like say, I cannot sleep, I cannot do this, cannot say that. So this kind of time is what we need, is also taking one supplement to help calm down, like that like anti sort of like stress, you know. So this also like a nutmeg is very important one. Nutmeg is like a very simple herbs or seed, easy to get, but it's very good for the nerve systems, very good for the heart disease. So the nutmeg is one of the best Tibetan herbs to restrain the heart muscles. So if we have the strong heart muscle, they're pumping better the blood things, and then blood get to the rest of the body is on time, sort of like. So this kind of reason is like even your heart is perfectly fine, but still it's good to use. And then another one also like all the nerve systems. So it's like the nutmeg is one of the very important. So this kind of tea, I think, is you do not need to use every day same herbs, but today use this, tomorrow use that, morning use this, evening use that. I think it's sort of like randomly you use would be very useful. So this is sort of like the diet part. Then the behavior part, yes, we can do behave for the mental behave and then physical behave. So also doctor before mentioned this, that the yogas, and especially the yoga is breathings. In the senior people, when we're talking like yogas for the senior peoples, and then we call it sort of like shetan, dektan, nguptan, sum, sort of like the stretching the body is one important to stretching all the muscles. Because if we don't stretch, the muscle is like stacking and then like closing like all the diaphragm. So then causing us difficult to the deep breathe. So the number one is to try to stretch the whole body, sort of like is very important. Stretching up and stretching down and stretching sort of like horizontal, whatever all the limbs is stretching is very important. Also like a closing back and then stretching. So this kind of all those movement is important. The second important of the yoga, part of the yoga, is like a percussions. So once you done all the stretch, then you do sort of like small coughing, and then you do the so this also is very good to like to keep the clean the lungs daily base. So this is also like the cup, like percussions on the front and then also on the back. So all those kind of, and then starting from the under the armpit. So this is we call the dekpa. So when you do the dekpa and then you try to make a little sort of like small coughing. And then the third one we call is ngupa. Ngupa is like breathing. So these three sort of like very important. And then when we're breathing, then you make sure is like breathing is the deep enough below the navels, and then fill that all the thoracic, and then empty down to make sure all the emptied through the like the below the navel chakra. So this sort of like to expanding the breathing and then to exhaling the breathing well. So this is also very important. And then there also, when you're breathing, also you can work with the 5 element, but maybe now so we don't have time. So if we have time, then I will explain a little later. And then, so this kind of thing is like part of the yoga important. Then the last part sort of like important from the like the meditation or the mind, like mindfulness, because it's very easy to get like distracted, very easy to get like a nervousness, very easy to get anxieties, this or that. And then in this is very important, we try to keep mind with you. There's one great master of the Tibetan Buddhism, Dzogchen master, they call the Zapabdru Rinpoche. And Zapabdru Rinpoche, he said, is there's 3 important things we need. The first, we need on our bed where we sleep, we need there is a body is sort of like visible there. Inside that body, we need a consciousness. Inside that consciousness need a sort of like relaxed peace. So on our bed, no body anymore means something happened, you know? Even though there is body, but there's no consciousness, is also what we call is it doesn't work. There's another one type of name. Even though the body is there, mind is there, consciousness there, but still if there's no like peaceful or the relaxing mind, always like a monkey mind, also is not something working. So these 3 they said is very important. So how we can do that? Through the yoga, through the breathing. So many ways we can do that. So this is sort of like what I want to say for the seniors, our beloved senior people would help these kind of things. And then, that is sort of like my, what I want to say, my contributions.
Thank you, Menpa Wangmo. Thank you so much. Yes, I want to do some of the percussion tapping that you mentioned with some of the coordinated breathing. Hopefully we can have some of our yantra yoga and breathing instructors help us with that. Maybe next time we can have Matthew or somebody can take us through a few exercises for this stretch and tapping. I know we do this tapping a lot in the kunye practice with some of the tapotment percussion movements, but yeah, it's really very useful. I know that Western doctors, when they kind of don't have a lot of treatment options for the COVID patients, and I've seen, Western doctors attempting to guide people through breathing exercises and stretching to open the lungs and open the chest. And but I think that they don't always have very good training for that. So the Tibetan yoga is very good for that.
Yeah, then on top of that, also then is like to preventing or to healing, also there's Tibetan herbs. So this time we are using those herbs to preventing way and also treating way is responding very well. So this also another there is.
Now, when you mentioned these, a few of these kind of simple home remedies that people can use for preventative or soothing. So with the, we had our milk tea where we do the reduction of the milk with water, about half and half, and then we do a light simmering and then reduction. And then I know that mixing the milk with the water reduces the fat and the heaviness, and then also prevents the milk from burning, so it's easy to simmer. and reduce. But can you mix the milk tea with a couple of the herb teas you mentioned? Can you do the clove or the raisin and or the nutmeg with the
If
milk?
you're mixing the raisins, cloves with the milk, then the milk immediately became bad because those has that the acid. So then milk doesn't do well at all. So then is milk became like a poisons.
Okay, so we don't mix any of those together as separate.
No.
Okay.
Milk you can use mixed with a nutmeg. Yes, we can use. In the ginger, yes, we can use, but normally we don't because it's ginger nature and then the milk nature is opposite. So we don't want to get like two opposite goes together.
Right.
And then, but is with the turmeric is very useful. Yes, we can mix with the turmeric, with the nutmeg, but is not with the cloves and also with the raisins.
Okay, thank you for that clarification. That's really useful. Yeah, we know in Tibetan medicine, we have many combinations of foods which are not appropriate and not desirable, but we don't have that sort of idea in the Western culture. So the Western culture doesn't have any prescriptions for mixing acidic fruits with with the dairy products, or using the fish products with the poultry eggs and this sort of thing. So so in Tibetan medicine, we have a lot of that understanding.
Yeah.
Okay, well, that's a really, really useful home remedies and a kind of basis for the treatment for the elderly conditions, you know, extracting the essences from the foods to support the 5 elements which are waning during the age. So thank you so much for all of that information. So as we start to wrap up and get ready to close, is there any other advice or important points that we should cover? Maybe I forgot to ask you about for this topic.
Maybe first we ask Dr. Gerry.
Dr. Gerry, would you like to kind of wrap up with a little summary? Anything that what advice would you give to our audience? We have listeners from around the world, different cohorts, different age groups. So what advice would you give for health and prevention and just general wellness for people in these times now?
I guess the most important thing is to really respect this virus. I think it's very natural in human nature as things get better to kind of, excuse me, become a little bit lax and a little slack. And what we've seen is when people do that, we get recurrence of the virus. So I think it's very important to really respect this virus and continue to maintain social distancing and wearing masks wherever it's indicated by the local authorities and governments and whatever. And try and limit large gatherings, especially indoors. So I think respecting the virus and maintaining an awareness of the fact that even though you feel safe currently and things seem okay currently, that the virus is still there and is probably going to be with us for a while. So I think respecting the virus and maintaining an awareness of that is very important. Not to be overwhelmed by fear or anything like that, obviously, because that's never useful. But just maintain it in your awareness and just be aware and present enough to do what needs to be done in your circumstances. And obviously the other things like Phuntsog was saying, and just generally to do what you can to maintain your health in as best you can.
Well, thank you so much for all of that, Dr. Steinberg. It's really a pleasure to have you joining us, and we really want to thank you for your brave, intrepid work, working with the senior population, working with the high-risk population. So thank you so much. It's really good to know that you're out there helping us out with the community.
Thanks.
So Menpa Wangmo, would you like to kind of summarize and bring it all home for us, give me closing points regarding these issues of discussion?
Yeah, I totally agree. As the doctor mentioned, number one is like a very important safety. At the moment, this the COVID-19, whatever the experts advising to us, so we should follow that is really seriously. And in the meantime, also try to drink more hot water than the cold water. Then meantime, you try to breathing is more sort of like you try to pay attention to your breathing. And then another one important is, as also doctor mentioned, so important we try to understanding as like what is the human life, what is the value of the human life. So the value of the human life is more like the supporting, loving, kind each other. So we try to keep that as much as we can. And then another I want to offer, also doctor is here. So now we thinking, I mean, we think the experts, they say is May this COVID-19 come back again, visit us, sort of like, even we don't want it, maybe they will come back. And then even they don't come back, but how long they stay, we do not know. So meantime, we need to worry a lot. So especially those nursing homes, if you wanted to learn more sort of like those spices, teas, or the Tibetan yogas or meditations, please contact to us, and then we can try to help you to show how to do, and then how to make those teas, what is the proportions of those teas, and then also how to breathing, deep breathe, or whatever that means. And then, so all those kind of things, we can help, either effective or not effective, but is through our sincerely we willing to help. So please contact with us, whatever you need it. And there are also people who listen this webinars or this video. If you know someone needs it, let us know. So we try our best. And then, yeah, if you need any so like more information about the Tibetan medicine, please come to visit our website. So we try to post something there as well as, so especially this, what I mentioned, all those like home remedy. In the next week, I'll try to make a sort of like writing together. We try to put on our website. So please come to visit. And then thank you very much, Dr. Gerry.
Thank you.
And also, yeah, it really is a great pleasure you're there, and all your knowledge, experience. And also thank you, Adam La, and then Matthew, and also all the teams. And a special thank you to all the listeners.
Thank you so much, Menpa Wangmo. It is really a joy to have you hosting our webinar, and thank you for all your work. So we will look forward to some more of those resources. And yes, as Menpa mentioned, please do check out our website. For our audience tuning in, you can check out our previous episodes of this webinar. We've had a lot of really great guests, and we've been very blessed. So you can check out our previous episodes on our website, and also you can find us on YouTube, where we have some archives there. So join our email list, like and subscribe. Please keep in touch with us. And anytime, if you have any questions or interest in Tibetan medicine or any feedback or comments, we would love to collaborate with you and hear from you. So for now, Dr. Gerry Steinberg, thank you so much for being our special guest.
Thank you. Thank you.
Yes, we hope you have a really wonderful rest of your summer, and stay well, stay safe. And Menpa Wangmo, thank you again, as always, for being our host. We appreciate you. Thank you to Matthew. Thank you to our support team and our translators. We will sign off for now, and everybody stay safe, many blessings, and we will see you next time. I am Adam Okerblom here in the San Francisco Bay Area, and this has been the Shang Institute School of Tibetan Medicine webinar series. We will see you next time. Thank you.